All right, good morning. This is Senate Health and Welfare. It is April 30th. Is tomorrow the first day of May? Wow. May Day. Okay, so we can all pick flowers. We can think of May Day in two ways. One, to pick flowers, and the other is that we stop bullets or help labor. Anyway, I'm gonna go pick flowers. So this morning we're looking at H 482, which is the Green Mountain Care Board authority to adjust hospital reimbursement rates and appoint a hospital observer. And then we'll move on after that to H 91, the Vermont Homeless Emergency Assistance and Responsive Transition Housing Program. Got there. All right, so 482, we heard from Nancy Kane yesterday regarding a different metric for assessment to evaluate hospitals and what they can, how they can help or not help, where they are financially. And her answer was inconclusive. She talked a little bit about cash on hand, and how difficult that was given assets that hospitals have and how to measure all of that in an emergency situation. She did talk about days of cash on hand and where that comes from. And I had last week, I think the committee had asked the Green Mountain Care Board specific questions with respect to 482, and Diane, you're here, Diane Lamphere, on behalf of the board. And do we have responses to those questions at this time?
Thank you, Mitch. For the record, Diane Lamphere, Green Mountain Care Board. I believe someone has been working on them. I know that Chair Foster submitted a statement in response to, I think it was included the Blue Cross and Blue Shield and Vaz's testimony, possibly even from
That, yes, it was. We did get that response to that testimony.
I think we still owe you some, some written. You want some written responses to some of the verbal,
Yeah.
So we'll work on that and get that to you as soon as possible.
Thank you. That would be helpful. And ASAP, given that once we finish our work on this bill, it goes back to the House. And then the House has to look at it and the consideration of whether or not they agree or disagree. Yeah.
And you just keep the questions real quick that we're asking of the Green Mountain Care Board.
Well, we asked Susan Barrett when she was here to write them down, and we haven't. So one of them was, how did they make a decision regarding the cash on hand days, 135 days, where did that come from? And then we also asked Senator Douglas, and we agree, what about critical care hospitals? Are all hospitals going to be faced with this situation anytime that we need to save Blue Cross and Blue Shield or other insurers, right? It's important. And then there were a couple other questions that we asked, and I think they related to perhaps the bonding piece, hospital bonding, perhaps the contracts with how the board looks at insurance rates and contracts. And there was one other that I think
Non-compliance.
non-compliance,
Material non-compliance.
material non-compliance. So those were all important questions to us. So I guess we need to set a deadline for getting that information, since theoretically it's all been information that you've had in decision making at the board to inform this bill. So I would say I'm going to look at my agenda.
I know
The
that
board is very sensitive to deadlines, as we are. So we do have it on tomorrow morning.
I'd love to be able to get it to you sooner than that, ma'am.
Do you think so?
I'll
That would be,
try.
that would be
Definitely.
terrific.
Because
Okay,
because of
that would be terrific. And then I'll just ask Jen briefly to come up, a short discussion on the bill, and then we're gonna stop. Jen, can you do something for us, please? And that is to walk through the bill one more time. So when we get some of our responses, you know exactly what we're hearing about. That would help.
Sure. Jen Harvey from the Office of Legislative Counsel. I will put the language up on the screen. 842 is an act relating to Green Mountain Care Board authority to adjust a hospital's reimbursement rates and to appoint a hospital observer. Section 1 relates to reduction or reallocation of reimbursement rates and risks to health insurer solvency. So it starts off with two definitions. Hospital uses the same definition as in the hospital budget review statutes. Hospital network is the same definition we've been looking at in a couple of places. A system comprising two or more affiliated hospitals and may include other healthcare professionals and facilities that derives 50% or more of its operating revenue at the consolidated network level from Vermont hospitals, and in which the affiliated hospitals deliver healthcare services in a coordinated manner using an integrated financial and governance structure. Subsection B said if the Green Mountain Care Board determines, after consultation with the Commissioner of Financial Regulation, that a domestic health insurer faces an acute and immediate threat to its solvency because its risk-based capital level has triggered a regulatory action level event pursuant to provision in Title VIII, the board may order a reduction of the insurer's reimbursement rates to one or more Vermont hospitals, as set forth in subsection C, until such time as the amount of the insurer's risk-based capital exceeds the company action level risk-based capital threshold defined in statute. The board shall only order a reduction in the reimbursement rates to a hospital that meets one or both of the following criteria. The hospital has more than 135 days cash on hand and had a positive operating margin in the previous fiscal year. Or the hospital is a member of a hospital network that at the consolidated network level has more than 135 days cash on hand or had a positive operating margin in the previous fiscal year. Or it directs the board to order a reduction in reimbursement rates to a hospital under this subsection only to the extent necessary to remediate the threat to the domestic health insurer's solvency. And in no event shall a reduction ordered by the board under this section result in a decrease to a hospital's or hospital network's projected days cash on hand to below 125 days.
So that also is another days that I'm looking at Green Mountain Care Board now. Diane, and that the 125 days is also a question that we have. How is that? Is that the lowest that is there? I'm thinking there must be a national mean or a national range that has been looked at somewhere. And what's the median or mean? And then what's the lowest end? And how do these things relate to that? And how do they fit with Vermont as compared with other hospitals in other states? Yes, that's.
Should I respond, ma'am, or Diane Lanford, Green Mountain Care Board? In very earlier testimony, and as we get to the end, it starts to become a blur as to whether it was spoke to in this room or another room. There was a chart that I believe that there were some ranges of what was adequate, what was sufficient. That I will go and find that again to see if to make sure that you have that.
That would be good. I'm not sure we have that. We'll look. Okay. The other question I have about this is, and it's probably more of a board question than a Jen Carvey question, but, or perhaps what in the bill, if anything, ensures due process overall?
I think that will be in the execution. So in how this is implemented by the board and whether they are providing, notice and an opportunity to be heard or some similar, given that the timing
It's an emergency.
concerns, right? The emergency time concerns, I think, it'll be up to the board to determine whether some of that process happens before a rate adjustment or, once rates have been adjusted, but providing an opportunity for the hospital to perhaps provide additional information that might shed light on its financial situation and its financial obligations.
And I guess the question is, do we need to spell that out in any way in here? Or refer to any other process?
I think you can. I think my understanding, I think from the board's testimony is that, or written materials is that they don't necessarily believe that needs to be spelled out. It's more incumbent upon them to ensure it occurs, if and when they are implementing this provision.
Can we get kind of a response from the board on how they intend to provide information, a heads up, and the due process provisions that they would use? There may be some provisions already in statute on this, or is there something we can refer to, or is there something the board is considering? I know it's an emergency, but everybody needs to.
You're right. You're absolutely right, Madam Chair and Committee, because the balancing act that has always been for the Green Mountain Care Board and others, and in this room, that has a responsibility and a mission to make sure that the whole system is not disrupted for one or the other. And I agree that there will be an emergency, and how do we act expediently, but at the same time thoughtfully, and balance those two things out.
If we could get comments back from the board on that, I know that there are others in the room interested in this. We could get a comment on that. And we don't want to hold up the world, when there's an emergency like this. We know there are cases where this absolutely must happen. At the same time, it could be a real surprise to an organization.
Right.
So having some process.
They need to have a comfort that how they're being treated is fairly, and that they have an opportunity to respond.
Exactly. Okay, so we'll think about that. Jen, any thoughts you have on that?
No, I think it'd be important to hear from the board how they see that
Yes. Okay.
playing out and whether they feel it's necessary to direct them to provide that process, or whether that is part of how they would implement any such rate reduction.
Thank you. Okay. All right, so we'll head along to the budget review.
All right, section 2 amends the hospital budget review statutes in a couple of ways. First, requires that individual hospital budgets established by the board under 18 VSA section 9486 must reconcile any significant deviation in revenue during the previous fiscal year in excess of the budget established for the hospital pursuant to this section, using a methodology established by the board. Second, it allows the board on its own initiative to adjust the commercial health insurance reimbursement rates payable to a hospital at any time during the hospital's fiscal year in order to ensure that the hospital operates within the budget established under this section. And third, it allows the board, upon a finding that a hospital has made a material misrepresentation in information or documents provided to the board, or that the hospital is materially non-compliant with the budget established by the board, appoint an independent observer with respect to any matter related to the board's review or enforcement under this section, if the board believes that doing so is in the public interest. And at the direction of the board, this independent observer can monitor the hospital's operations, obtain information from the hospital, and report findings and recommendations to the board. It allows an independent observer appointed under the provision to have the right to receive all copies of all materials related to the board's hospital budget review, and that the hospital must provide any information requested by the independent observer, including any information regarding the hospital's participation in a hospital network. And it requires the independent observer to share information provided by the hospital with the board and with the Office of the Healthcare Advocate, And in accordance with subdivision D3 of the section part is tying in the Office of Healthcare Advocates confidentiality requirements, but shall not otherwise disclose any confidential or proprietary information that the independent observer obtained from the hospital. And it allows the board to order a hospital to pay for all or a portion of the costs of the independent observer. And then section 3 sunsets that, just that last piece, the authority to appoint an independent hospital observer. It sunsets that on January 1st, 2030. All the rest of it would stay, all the rest of the bill would stay in effect. And the act would take effect on this.
So this will go into effect on passage. And then it's like.
And then one piece of it, just the observer part, would sunset. The rest of the authority would remain. But, obviously in section 1, that's with the trigger of a domestic health insurer, the risk-based capital level that triggered a regulatory action level event. So that's it, dormant unless and until that trigger was met.
So there's no period of time for which an observer is appointed. I mean, right now it's 16 months, the current process for the UVM Health Network.
In that current instance.
Is 16 months. There's nothing here that restricts or limits the time, but that ends in 2030, so it's not gonna go past that date.
Right, the authority to appoint an independent observer, again, upon either a finding that a hospital has made a material misrepresentation or that it is materially non-compliant with its budget. So those are the triggers for that observer authority to come into play, and then that would only be in effect until January 1st, 2030.
These are serious actions, that you come in, give a budget, and for some, the board has to have a reason. And you have to be materially out of compliance with the budget you presented. And I think if you say, well, we've made so much more money because we had a wealthy donor die and left us $20 million.
Ooh, that'd be good.
That would be good, but then understand that's a reason.
Yeah.
It's, well, we just made more money than we thought we were going to. And our system has to work on trust.
Yeah.
I need to be able to trust that when you give me numbers, they are correct and valid. And this wasn't just once, this has happened on several years running. So at that point, I think the board says, we have reasons not to trust that the numbers you're giving us are valid, and we need to be able to find out. I mean, if everybody plays according to the rules, there's no problem. Nothing will happen.
That goes to your non-compliance.
Yeah.
Right, although I do just want to flag that between the existing law and the adjustments allowed from the bill, there is the ability to adjust a budget during the year. So if there's a large amount of unexpected revenue that comes in, there are opportunities during the year for a hospital to say, and we need to have our budget adjusted.
And the other way, if
And this
there's
would allow it
another
give the board
pandemic,
right.
and
Right, oh, right,
yeah,
yes.
I mean, they
being able
can
to
go
take in-
either way. There's
Yes.
a mechanism to adjust.
Right, I just want to be clear that being materially non-compliant with the budget would be having not also not brought to the board's attention that there needs to be an adjustment in order to be compliant.
Any questions for Jen? Any other questions on this one? There are people around the room who might be able to answer some of us. Yes.
More general question, we have 2 weeks after this week, right, before morning committees are done?
Uh-huh.
Okay, great, so that gives us time. to
Yeah,
get
so
the answers.
we fall asleep on the 14th. But after that, we will also have an opportunity to come together for, different needs.
Okay.
Adjustments, but we would like to finish this bill soon. And there's a lot of unhappiness out there. I can see unhappiness in the room. That this is not something that we enjoy in any way, I think. I don't know if the board enjoys it, but we certainly don't. I don't think this is something, I would say probably the board doesn't enjoy this. This is not a good way to have, regulation. This is not regulation. This is not, I won't say a knee-jerk response, but it's certainly an emergency something. So we really would like to get by this and past it. Hopefully not have to use it.
14th is Wednesday, are we going from the 16th?
16th.
Okay, great.
Oh, we're gonna
You
get
have
to the
through-
16th.
Yeah, you have through that Friday.
Yeah, that's right. 14th is. All right, so Jen, there's nothing that we can do at this point, except I think asking you to think about some of the questions that you've heard about and that may or may not relate here. I know that there's been a conversation regarding bond issues within hospitals and how that might or might not relate, and how explicit do we need to be in the bill regarding some of those concerns, or is the Green Care Board looking at all of that?
Right, I think that's, again, addressed to some extent in the board's testimony. I think really a question for this committee is going to be, I mean, you have heard different proposals from different stakeholders, and I think the question for the committee is which direction you want to go.
Got it. I know that the healthcare advocate indicated some interest in the looking at the bond issue. Sort of partial support for requiring action that does not breach financial covenants, the way it's worded there. I think we should think about that and whether or not legally that's something that makes sense.
I'm not sure it's right. I'm not sure it's something you need to put in statute. Again, I think it will come down to how the board implements. And I think, testimony that you've received from the board, suggests they're looking at kind of balancing competing financial requirements among the parties.
That sounds like a good line.
It's created almost like that.
Might think about that. I think the big piece here then is the building trust, and that goes to a due process. We've seen enough violation of due process in our country, in our state. Okay, so this is where we are. There is some a solid commitment on the part of number of folks for the bill as it's written. We've raised some questions and we'll see where we go with it. My concern is due process, and then some of the other questions we asked about the days, and I think the critical access hospitals, the smaller hospitals, how far do we go? And could have a critical. Yeah. We can't be hypothetical. I mean, we have to think about where we are right now. So I'm looking at, Diane, we're meeting again tomorrow on this bill. Hopefully we'll be able to have some thoughts about it, and we as committee members will try to go through the testimony that we've had in writing and heard, and then think about what, if anything, we'll do to modify the bill.
Well, thank you, Madam Chair, and I appreciate it. And on behalf of everybody at the Green Mountain Care Board, we know no one really wants to be able to execute that. This is a break glass if fire situation, and everybody wants to make sure that if it has to be used, that how, when, and the process is important to lay out, and then hopefully it is not required to be used. And through the wonders of technology, I've already texted questions, moving around ASAP, plus the House Healthcare has 126 and they're working on markup and they had questions as well. So we definitely being able to sit here and be able to start to put that in motion right now.
Good. We need that. I was hoping we'd have it today, but we don't, but we'll get to it tomorrow. The other thing I will say is the word that we've heard, and Senator Cummings, you're absolutely right. This is a matter of trust. If we can't trust our regulatory organizations, boards, and folks, we're not in a good place. And part of what's going on now is building trust on each side. We have to do that. You need to have trust all the way around. You can't have a hospital or an insurance company or another organization trying to find the loopholes. We can't have that. And secondly, we can't have a regulatory entity that has values against or for any specific organization. We need fairness, and fairness builds trust. So I go back to my new process. But so that's where we are. Senator Gulick.
Thank you. I feel as though in this building, we like to create binary structures and we like to have winners and losers. That's just the way it seems to work here. I guess I don't quite understand what would be in it for the Green Mountain Care Board to jeopardize our healthcare system. That's where I understand the trust piece, but I don't see the other side, why they would ever want to jeopardize.
Everyone is human.
True.
And so that's, I think, ensuring that the human values that are on the board have exactly the intent that you have expressed. And we see what happens when at the federal level, when there is an intent on retribution or one value set. We just raised the trust level up because it's been lost. It's been lost for the UPM network and it has to be regained. And so we don't want that to be perpetuated in any way by anyone. So that's it. We are going to take a little